evening, ladies and gentlemen. Can I have these lights off, please? Front lights. Gentlemen, at the outset, I would like to extend the greetings on the occasion of Women's Day and wish all of you a happy, contented, and healthy life. And to have healthy life, we are going to discuss three aspects of the disease process. In fact, I wanted to start my presentation with the quote which ma'am has already told, that you are the masterpieces, and I feel honored and privileged to stand before you, before so many masterpieces and so gorgeous ladies of Pune. And in fact, I would like to thank the organizers to give me this opportunity to be in this August gathering. So what I'm going to do is discuss some aspects of thyroid disease. And I'm sorry I won't be able to converse in Marathi, but I would like to speak in Marathi, in Hindi and English, so that most of the people can understand. So what do you mean by thyroid disorder? I would like to make this session more interactive so that I can also understand, you can also understand various disease processes. So any one of you can tell me, patients aate hain, hame thyroid ho gaya. So can any one of you tell me, what do you mean by thyroid ho gaya? Yeah, please. Good, excellent. So thyroid basically is a hormone which is there in front of the neck. So any disorder related to thyroid, be it structural problem, be it functional problem, will be thyroid problem. Now I'll discuss the various aspects of thyroid diseases. Now it can be structural problem, as I told you. It can be functional problem or some cancerous growth, kuch growth ho gaya jisko we call cancer. Now look at this young lady. She has got a swelling here, which we call goiter. Now whether this requires treatment or not, that is secondary thing which I will discuss later on. But look at another lady, a huge swelling, itna bada goiter hai isko. Definitely she may require treatment if this is such a huge thing, because not only it looks ugly, but at the same time it can lead to pressure on trachea and esophagus and other things which I will discuss whether to treat or not treat. But anything related to this is the thyroid disorder. Commonest disorder which we see in our day-to-day practice is less function of the thyroid hormone. Thyroid basically secretes hormone which we will call thyroid hormone, and this is required for the various metabolic functions of the body. If there is a less thyroid hormone, we call hypothyroidism. So what are the various symptoms of hypothyroidism? I think most of the ladies should be conversant with the hypothyroidism symptoms. So what can be the symptoms? Now look at this lady, having swelling around, aankhon ke niche there is swelling, swollen face. Patients can have hypothyroidism. Then dryness of the skin. Most of ladies will start complaining कि हमारा skin dry हो गया है ना. They have to use moisturizers more often. Then very common menstrual disorders. There may be ladies may have infertility, menorrhagia, cycle disturbances. There may be underlying thyroid dysfunction. Muscle cramps. They have a lot of muscle cramps, patients, when they have hypothyroidism. Then depression. Patients may have only depression and no other features of hypothyroidism. So any patient having depression must be evaluated for thyroid disorders. Then constipation. Patients complain that there's a onset of constipation, and whatever they may take, I mean their bowel movements are not there. So these patients should be evaluated for hypothyroidism. Then cold intolerance. Even I mean in summer they feel that they are feeling very cold. So once the patients have these symptoms, one should suspect hypothyroidism. Then look at this two young girls. Can you appreciate shallow face, pale face, there is a swelling on the face, and of course this girl has a huge goiter. Then loss of hair. Loss of hair can be symptom of hypothyroidism. So all these symptoms can be due to less functioning of the thyroid. Weight gain. How many of you think that weight gain occurs in hypothyroidism? Yes, you think. Others don't think. When patients आते हैं कि मेरा तो weight बढ़ रहा है, thyroid में गड़बड़ है. Okay. Invariably you will find people doing their thyroid test for weight gain. But let me tell you, maximum weight gain in hypothyroidism is not more than 4 or 5 kg. Right? Not more than 4 or 5 kg. And why this weight gain occurs? Because in hypothyroidism there is water collection. And maximum water collection cannot occur more than 4 or 5. Any weight gain beyond 4 or 5 kg is fat. And fat occurs because we eat. So weight gain is invariably because of this thing, not because of thyroid dysfunction. It does occur, but not more than 4 kg. The message which I want to convey that if there is a weight gain is there and slight thyroid dysfunction, please do not attribute weight gain to thyroid dysfunction. It is because of our eating habits, or maybe we are not exercising. Okay. Now I will cover the various aspects of thyroid during hypothyroidism during pregnancy. Very important. Any lady who has thyroid dysfunction in pregnancy must get her thyroid functions done every 6 to 8 weeks and keep thyroid functions under check. If thyroid functions are not kept under check, if there is a thyroid dysfunction, the child can be born mentally retarded, or look at this child. They can be mentally retarded, they can have a lot of problems like they can have neonatal jaundice in the newborns, they can have hernias, constipation, and so many things. So very important that during pregnancy, thyroid should be normal. This is a young girl which came to me about a month back. She's an 11 years old girl, and look at her height. So any young child who's not growing properly in spite of adequate nutrition, one must suspect thyroid dysfunction. Then what are the reasons of why this hypothyroidism should occur? I will not go to the interior details, but just main reasons are, one is the iodine deficiency, especially in the Himalayan belt, people living in those areas, and those patients can have large goiters, which you saw earlier. But commonest cause is, I won't go into details of this picture, is the autoimmune disorder, which we call, which are more common in ladies. Then any lady who has done any surgery on thyroid and subsequently thyroid is not functioning and they develop hypothyroidism. Or if there is a radiation to this area, neck area, they can develop hypothyroidism. But commonest, these are the two commonest causes of hypothyroidism. If that be so, how do we diagnose? Diagnosis is very easy, just thyroid test. And we need not do whole gamut of tests, T3, T4, TSH, just T4 and TSH are good enough. If TSH is high, there are various causes of different types of hypothyroidism which I am not going to discuss. I am going to discuss common garden variety of thyroid dysfunction which we see in our day-to-day practice. If T4 is low, TSH is high, patient has got hypothyroidism. And then this test can be done to find out whether patient will require medicine lifelong or for short duration. And sometimes if there is a swelling, then we tell patient कि एक सुई डाल के टेस्ट कीजिएगा to find out कि what is the etiology, इसका कारण क्या है swelling का. This FNAC is done for that thing. लेकिन किसी को thyroid कम है, then tests are T4 and TSH. Now comes the important aspect, treatment. Let me tell you, treatment is ये एक ऐसी disease है जिसका treatment is very very satisfactory, provided patient takes treatment regularly. And tablet is either Altroxin है या Thyronorm है. Only precaution is that you take early morning, empty stomach. And maybe आधे घंटे के बाद, 1 घंटे के बाद कुछ ले सकते हैं, but it should be taken empty stomach. And then dose will depend upon the TSH and that your doctor will tell you. And along with the Altroxin, please do not take any tablets like iron की tablet, calcium की tablet. Altroxin खाली पेट लेने का. Then एक बार Altroxin शुरू होगी, how to adjust dose? Depend करता है कि TSH कितना. If suppose TSH is very high, हम इसको gradually increase करते हैं. But young ladies हैं, say 30 years old lady, TSH 30, we can start with the full dose. How long? Generally हम बोलते हैं कि एक बार thyroid means lifelong. 90% cases में it is lifelong, but still 10% cases में it may be for short duration, which I will discuss. Then repeat test कब करना है? I find lot of ladies coming to me every second or third month with their thyroid test. No. Once thyroid test has been done, patient का thyroid एक बार हो गया, treatment start हो गया, repeat test 3 months के बाद हो गया. If that is normal, then repeat test should be after 1 year.